with the whole experience, the first advice, actually not the first advice, but the advice that I believe is gonna be the long standing advice with me is to get a midwife rather than going to see a general practitioner or even paying to go to see a doctor. The advice that I got from one of the nurses at the general hospital, and really and truly from research, and when I think about it, taking into consideration from the research, what I learned was that midwifery and nursing really is not the same thing. A midwife and a nurse, they don't have the same kind of training. A nurse really and truly is somebody who is trained to deal with emergency situations, more or less, wounds and stabs, and to assist in surgeries, and to assist in like medical equipment, and the functionality of the general hospital is really and truly where nurses fit in. And this is not to downplay the role of nurses or to minimize the um, effects of their presence in society, is what it is, to highlight the fact that they are already very overwhelmed with the already high cases that they have to deal with in most countries, if not all of the countries. They already have a lot of gang violence, they already have a lot of just regular small accidents and all kinds of stuff that they're dealing with, and then they might have some truly miserable patients. A person like that is not in a mental state or an emotional state to receive you and your joy and all of the she don't want to take on what you're dealing with, because she already heavily burdened herself. So respect to all the nurses. And this is why you go looking into a midwife, because that individual, she's trained, she already through practice and through experience, she already dealt with a lot of very rowdy people in her training, and in the the experiences that she has because of the legal aspect of midwifery. She feels bound to different obligations. She feels obligated to you in a different way. A nurse might not have no she might not feel no sense of obligation to you, just a next person. But to a midwife, you priority. You and your baby, you guys are priority to them, because that's their central focus. The central focus is making sure that you have the mental capacity to go through the pregnancy. And if not, what she would do is to assist by probably sharing a story with you, or probably just chatting on the phone with you for a little while. She might tell you an experience about a next lady that she knew, or she might give you the assurance that, hey, I hear what you're saying, and from the experience that I have, this is completely normal. The most terrifying experience, well, I ever heard from really somebody else. So I went to do a follow-up exam on the secretary, the receptionist that I met at the lab where I went to do the follow-up ultrasound. She was like, why you look the way you look? Because maybe I look a little bit scared. So I proceeded to tell her I'm not really feeling all of that confident, and I don't really feel like I really want to find out the results, because at least I could tell myself a story not knowing what happened, what the, the facts. At least I don't have had evidence. I could say, well, by the grace of God, everything is gonna be okay, and this is not the, I don't have a visual. So she began to comfort me, and she was saying, hey, before I even got into Christ, I had these experiences. I went to the general hospital, and I was complaining. I was there and I was complaining, and I was telling them that I'm not feeling okay. And the nurse, she came and she was basically saying, oh, all they just want to make babies, all they just want to have sex, and all they just want to make babies, but when it's time to make baby, all they don't want to go through the problems. So she ended up losing that baby that she had at that point in time, because the baby ended up pooping. The baby ended up stooling in her, and nothing was really done at the time, because they just figure she's just a next rowdy lady, just being miserable about it, because like I say, they're not under any obligation to attend any counseling sessions to talk about the experiences. They're not if they're not interested, they're just not interested. So it's in your best interest to go to somebody who would be interested in you. Otherwise, it will turn into an abusive relationship. Whenever you find yourself begging somebody for the proper attention and care, that's what it's called. You are in an abusive relationship. So to avoid getting into an abusive relationship, when what you really need is love, support, and care, look into midwifery YouTube videos. I found this, you can check out my profile and you are gonna see one of the videos of this lady that I came across. I found her very informative, because I was unable to, well, I was not unable. I contacted the one of the midwifery places that I found, and I explained to them what had happened, and they recommended that I go see a doctor, and then we would discuss counseling, because that's what I really inquired about. And I found it ridiculous that, but what I think is that they didn't really believe me, or maybe they don't really want to have to do anything with something like that, or maybe they just want to confirm like something like that really did happen, so that a lot of people get to a point where they're so distrusting and they just feel like somebody trying to solicit kindness and compassion from them, that they would be suspicious and speculate the worst. So it gone from innocent until proven guilty to guilty until otherwise determined by probably a life or death experience. And at the funeral they will say, oh, you know what, that person wasn't such a bad person. So to avoid all of that, it's not necessary. Nobody have anything to prove to anybody about the quality of individual that they are. So try to avoid finding yourself in a space where you feel like you have to prove that you're worthy of being a mom, or that you're worthy of being respected and valued and appreciated, even by people who are being paid to do so, because it could be a little bit heartbreaking. Alright, so I'll see you in the next video. Peace.